Hello, thank you for having me. Today I'm going to talk to you about the effects of drug-induced psychosis, as well as mental health and substance abuse awareness. What is drug-induced psychosis? Drug-induced psychosis is an altered state of reality that can be a long or short term, depending on the length of abuse, the severity of the substances, the combination of substances, and the levels of dosages being ingested. Drug-induced psychosis can be defined as losing touch, where you become unrecognizable to yourself, you become unrecognizable to others, and you lose interest in things that you once found joy in. You lose interest in your passions and just things that you like doing. You lose track of your priorities, such as family, such as friends, school, and even work. You develop a misinterpretation of your life and life in general. A misconception of the term drug-induced psychosis is the labeled term psychosis. This is a wrongful diagnosis and it's a misconception of the illness and enhances the stigma surrounding drug-induced psychosis, mental illness, as well as addictions, and is based primarily off of assumptions. Often the diagnosis is inconclusive or hard to determine because everyone's experience is different and it is hard to compare them to one another to come up with a conclusive diagnosis or specific illness. What are the effects of drug-induced psychosis? Drug-induced psychosis can enhance pre-existing mental illnesses or introduce new ones. Primarily, the mental illnesses that can be developed are bipolar disorder and schizophrenia. But in addition, you can develop symptoms of severe depression, severe anxiety. You can have manic episodes, periods of elation in which you feel godly, or periods in which you feel so low that you can't get out of bed, you can't function as a normal human being. You can also experience disassociation and periods of blackouts where you don't know where you are and you don't know what's going on. You don't know who you are at times, as well as paranoia and hallucinations. You could hear things, you could see things. Again, also depending on the severity of the substance, the level of the dosages, and the combination of substances being used, as well as the length of the substance period in which you were using. Substances that primarily can affect drug-induced psychosis are LSD, ecstasy, MDMA, cocaine, and marijuana. And again, the length of use, the severity, and the combination. Treatment for drug-induced psychosis. Treatment begins with immediate termination, complete exclusion of all drugs, all substances, alcohol, marijuana, any of the substances you are using. Begins immediate termination. This part of the process can be very hard as you begin to develop withdrawal symptoms, which can enhance the pre-existing symptoms you are already experiencing. Withdrawals depend in severity, again, on the substance, the dosages, and the prolonged period in which you are using. In order to do so, in most cases, you require medical assistance, medical professionals, often supervision for withdrawal clinics and facilities. Often you are prescribed with medications that help ease the pain and suffering and help with the efficiency of detoxing your system. Often you will be sent to either a detox center or a rehabilitation center, often admitted into mental hospitals or psychiatric facilities, just to monitor and make sure that you are doing okay, because at times your life can be severely in danger depending on the substance. Other forms of support and assistance are CBT clinics, so cognitive behavioral therapy, detox centers, Narcotics Anonymous, and Alcoholics Anonymous. Primarily, the most important thing for someone experiencing drug-induced psychosis is support. Community support, family support, support in general. knowing that you are not alone is the most important part of recovery. Thank you so much for having me, and I hope today you've learned about the awareness of drug-induced psychosis and the effects that it can have on a person and their physical and mental well-being, along with encouragement to end the stigma. Thank you.